Hi everyone, I welcome you to the next session of your lay counselors training program. So today's topic will be on behaviors causing concern in elderly. So I hope you are all enjoying the sessions as the days come. You have learnt the skills of counseling and you have now we are into different topics like the last couple of weeks we had seen about couple therapy or then about behavior causing concerns in children, and now our topic will be on behavior causing concerns in elderly. So today's objectives of the presentation will be to understand what is actually aging and what constitutes normal aging and the behavioral changes that are seen commonly in elderly, and we'll try to understand that by understanding how aging occurs and what as a result of it what are the problems that can occur and why these kind of behaviors are occurring. And finally, what as a lay counselor, what your role can be, like when you're seeing a elderly person with some kind of disturbances, what kind of assessments that you will be expected to do and when to refer, and in case if you're dealing with them, how you can help them. So this will be the general outline of the today's presentation. So going to elderly, who are the elderly people, especially since this COVID time started, we all kept discussing about how there is an increased risk of mortality in elderly people. Who should be considered at risk, and why is there any particular age and all that? So like there are different cutoffs to be considered as senior citizens as such. Like for example, while booking tickets for in your train, the age cutoff for male and female to be considered senior citizen is different, and the same with retirement age at a public sector versus a private sector working. And like that, there are different cutoffs at different situations. So in general in India, as per the available law, such as the Maintenance and Welfare of Parents and Senior Citizen Act of 2017, elderly is someone whose age is above 60 and is of age 60 and above. And across the world, wherever you see, generally the cutoff range is somewhere from 60 to 65 with some variations. So at most places, the retirement is also around the similar age cutoff of when you consider them as elderly, and that is when the retirement age cutoff also comes in. So rather than trying to understand, looking it into categories of, like 0 to 1 years of age is an infant, and then adolescence is at 13. Instead of seeing it as numbers and cutoffs, elderly is something you should understand that it is more than just a cutoff of number. It's a social construct. With the process of retirement happening and all that, there are certain roles that are newly assigned to them, and there is a cessation of certain roles that happens with age. So we need to kind of visualize that elderly are people when there is a transition in the adulthood, wherein after you finish your school, your college, and you when your work is set and you start a family and you start working and keep running for your work and the welfare of the family, and there comes a time when there is a change in the whole role. Your children grow up, they start their own family, and then there is a new role of you being the grandparents or the father-in-law, mother-in-law, and all that. And there is with retirement in the work or some other, you also decide to cut down on certain work, your children will take care of the family management, or in case of businesses they come and start helping, and there is a cessation of certain roles also that happens. So if you overall look, it is not just merely the number, but it is a social construct of the overall change from the adulthood into elderly that happens. So in case of elder, why is that, like there should be change, or why should there be a retirement, and why is that the roles assigned to you change, and how you feel about it, or everything changes, is because of the aging process that happens. So to understand it biologically, see, aging is a very normal process that every one of us go through. When it is in childhood that you grow, as you age, you grow, you mature. We have seen about the growth of the brain and the neurons, and by your adulthood, it is at the growth has been to its maximum limit, and we start functioning. But then as you keep on going, age, there is accumulation of wide range of molecular and cellular damage that happens throughout our lifetime, that will gradually lead to a decrease in the physical capacity and mental capacity, and overall leading to growing risk of diseases, and finally the ultimate end point is the death that happens. So aging is something which is natural and biological that happens. Because of that, there are numerous changes that each person will undergo. However, you should also understand that there is no hard and fast rule, like at this age this should happen for the everybody and all that. It's neither linear nor consistent. At some point there can be a rapid change, at sometimes there is a plateau and all that. And this changes, that physical accumulation and all that we were discussing about, it is neither linear nor constant, or it is only loosely associated with age. We would have come across people because of multiple reasons, like at 40 to 50 years of age there can be multiple physical comorbidities and multiple medications they are on, certain treatment they undergo, and multiple other reasons that make them feel aged much more faster. I'm in the sense, there is a decline in their physical and mental capacity, whereas some elderly who's very healthy, with less cellular damages, who are much more fit and active than somebody at 50 and 60. So you cannot compare it exactly by the age number. That's why I kept on insisting that it's not just about the age number, rather it is about the capacity the each person has. So while someone else can have significant loss at their capacities at a younger age when compared to an elderly, so it keeps on changing to person. But but the bottom line is, there are biological changes that leads to significant changes in both your physical and mental capacity. So I keep saying that there are changes. So some examples or a general overview of what are the physical changes that are associated with aging. For every one of us to happen, it is only matter of when it happens. So it's for example, in sensory system, as we grow older, there is an impairment in the smell and the taste sensations, which in itself will affect your appetite, and hence the food intake gradually comes down, and their associated dental problems also will be there, and hence difficulty in chewing, digesting and all that. So gradually there is a loss of body weight, your muscle mass decreases, and there is a gradual decline in the vision and hearing, which will seriously impact the amount of or it puts a lot of restrictions on your mobility and extent of your social interactions. And there is a muscular loss, which will lead to weakness and fatigue, and your reduction in appetite and nutrition also contributes to that. And there is a gradually, as we age, the hours of sleep each person has also reduces, and the quality of the sleep also, there is a change. And as we all know, that which is commonly considered as a very normal thing, is memory loss. We will go into detail of what is memory loss and what all constitutes when a person uh, develops memory loss, when to consider it normal and when it is not. So these are some of the physical changes that are associated with aging. And when it comes to brain and the neurons as specifically, it is just said that approximately there is a rate of loss of neurons around 1% every year after the age of 60 years. Again, it's not a hard and fast rule, but then the average expectation of or a prediction of that's how it goes. And and in the whole brain structure, the loss is not uniform. We have in the very first session, you have read about the different parts of the brain and neuron development. So it is said that there is a great, even in normal aging, there is a greater loss in neurons and connections, the nerve connections in the brain, particular parts like the frontal lobe, wherein your planning and execution and all that functions are responsible for, is the frontal lobe, where the neuron loss could be greater, and the hippocampus, where the memory is stored, and other beyond the the cortex, your different lobes. We read about the subcortical structures or the midbrain and all that, and then with the parts which affect your sleep and your walking, the gait and everything, those can have greater loss when compared to other things. So loss doesn't mean that there is a complete loss of function. It, yeah, because of the nerve connections also, it is about the how the quality of it, it becomes more slower than before. So it is not like we have millions of neurons. So it is not like the death loss of the neurons is going to lead to complete loss of a movement or functioning or talking and all those abilities. There will be subtle changes, and the quality of that gradually keeps reducing. Therefore, as I was telling you before, dementia or the memory loss that we are going to deal with is not just about the neurons that die. There is also, accumulation of certain toxic substances that happens over years, that there will be different accumulations in your of substances in neurons, such that the functioning of that is affected. That is why dementia is not just the memory loss that we think about. For each person it can be different. There are different types of dementias, and it occurs at different ages, and it will have different manifestations as such, and not merely just a loss of the memory functions. So in overall, to just sum up or understand, um, when I said that aging is very natural, the cell damage occurs because of different reasons. So, we would have read about mitosis, meiosis, that is the cell divisions that happen regularly in our body. So, it is said that whenever each cell is destined to divide only for a certain number of times, and after a certain period of time, it just stops dividing and it undergoes death. So there is each part of your body, in every organ, in every region of your body, such kind of things keep happening. So after a certain point of time, there are no more new cells that are formed, and the cells which were repeatedly dividing for many years and many times, after a certain period, it is destined to just die. It cannot keep dividing into two more cells, and then to four more cells, and to eight more cells, and exponentially grow. There will be a time wherein that stops. And also, with age, there is wear and tear kind of thing, like any other physical objects and gadgets. There is wear and tear that happens to our body also, and there is accumulation of certain toxic substances such as the free radicals. So we don't need to know what are those free radicals exactly are, but then those are capable of going and damaging your cells and causing death. That is where this role of this antioxidants and are comes as a role, as a where we try to an extent to to reduce the rate of cell death. With the cells which are destined to die, we cannot do anything about it. But then wear and tear and accumulation of toxic substances are because of multiple reasons. Our lifestyle, or the comorbid physical illnesses of diabetes, hypertension, all that plays a role in how quick the cells die in our body also. That's why having a healthy lifestyle and taking supplements and antioxidants and all that is a way of prolonging the damage that occurs, and aging is eventually going to happen, but then to have a healthy aging, that's what probably means. And overall, along with all these physical changes, many people are at risk of developing physical illnesses, long term diabetes, hypertension, and some have to survive cancer and so on. So all these are some of the physical changes that occurs in the body as we age. So because of that, you will get a general idea that there are certain limitations in our physical capacity and also the mental capacity that happens with age. So now coming to the psychosocial changes. So the difference, or how we age and what we perceive and how our experience of aging is going to be, is not just the physical changes that happens. It is also the psychosocial changes that happens during your retirement or when you become a senior citizen. So we were discussing in the very beginning that aging as such is not a number, it's a social construct. So there is going to be new roles or change in the roles, especially or as one retires, there are a lot of psychological experiences that a person might undergo. Some people can be well prepared for a retired life. You would have seen among your peers, and you yourself would have experienced this, wherein some people during their adulthood are more worried and plan about their retirement, have better retirement plans, whereas some people who want to keep working might not be ready for a retirement. It's not like just a person who has been employed somewhere. It is about you. If you own your own business or something, or whatever it is, you might be forced to stop working at a certain point of time, be it because of severe physical illness that you develop, or when you start having some memory problem, or some that capacity to do things skillfully as before, as it declines, you might be forced to stop work. So the attitude towards retirement is varied from one person to one person. Some people might start feeling like, okay, and hereafter I'm just a useless person, redundant at home, whereas somebody might think that I have worked hard and I deserve to enjoy this period of not working anymore and not worrying anymore. And generally the status and the attitude of retirement varies from person to person, and in the community where they live in, how the retirement is perceived. And as we age, as we have so many life experiences, there are as we age, we have to face losses, be it the friends from work, your friends from childhood, or some family members, or your own spouse. You will have to face such kind of loss, wherein there is going to be change in the your immediate environment or the people with whom you interact. Family members death can be of anything. It's not necessary that somebody only who's elder to you will die. So any kind of loss is something that you might have to face when you become as you age. And for many people, there can be change in the home and other possessions that they have. As children grow and all, especially these days, it's very common that most of the people in the next generation move abroad, they become NRIs, or they get their green cards, and then they want their parents to come and live there. It's more like generally many of them might feel that they are being uprooted from one place, and at that age to go to a new place and to plant yourself there, wherein everything is different. Your daily interactions and the people you meet and the kind of hobbies you will have to go through, the food, everything changes immensely for many people. And that is why, as you would have seen, lot of elderly generally prefer to stay at the place where they grew up or spent most of their adulthood, wherein because they are comfortable, very familiar with the places. There are certain habits or regular rituals they'll have to go to walk, early morning walk in a particular park where you have a set of friends that you meet. Then you go to the particular coffee shop that you like, and you go have your morning coffee there and read newspaper, discuss the general current affairs with other people. All this is a habit or a ritual that you will have, and many of them may not like to change that at that age particularly, and might have difficulty in adapting to the new things, but for multiple reasons, especially when one partner dies, the other is forced to leave the house and go and live with the children. So change, and also your possessions also, you might no longer need your car and things like that, everything changes. And for some, there might be like you need to be dependent on your children for income, or the amount of income changes, it all varies from your retirement plan, and not everybody might be bestowed with money abundantly, or the or handle it on their own. And as the physical changes happens, that mobility is restricted, there is some physical weakness or some sensory issues, that you are completely dependent for activities of your daily living. What I mean by activities of daily living is from the time you get up to your usual activities of to brush your teeth, to have a bath, dress up, eat, or when you might need help even to go to the bathroom. So you might become dependent for everything on someone else, and it all depends on who's that other person available, and at each person's attitude towards some many of them might feel that they are being a burden, or they are causing much more difficulties for their children, and so on. So these are some of the changes that the stress that develops because of all this kind of psychosocial changes that happen with aging. And there are other psychological changes also that happen. So as we were discussing about the brain and the neurons and how they die, and their the different regions of the brain is affected gradually, the how your process, your intellectual functioning also, there is a decline. It's not just in dementia, for elderly as such, as you grow older and older, the speed of processing the information, and the how you manage or the familiar situations versus a new situation, how so you might be much more comfortable handling the things which you are very used to, whereas when suppose there is a change in the place, suddenly to navigate yourself in the new situations will be difficult for anyone as they age. And with more so with as the age increases, the difficulty levels also increases. And because of the decline in the brain functioning, the skills of problem solving, the ability to think about multiple solutions and then finding out the best solution possible, all that can be limited for the elderly. Somebody who had been functioning very well before, can suddenly you might feel like they are not able to do all these things anymore. And when it comes to memory functions, generally short-term memories of immediate recall is generally intact, unless there are other issues that is causing a difficulty in registration. Whereas as we were seeing about the speed of processing and the working memory is kind of affected, and long-term memory keeps varying. For most of them, well rehearsed, or the memories that are emotionally attached to, and certain memories which has been again and again recollected or has special meaning, those things tend to retain longer, whereas certain aspects of your old memories you might lose. So it keeps changing from person to person, and also from time to time. At sometimes they might be able to recollect something from the past, and sometimes they might not be able to. So all kinds of memory are affected as we grow. And now that we have seen that there are physical changes that happen, there are psychological changes, and the social structure in which the elderly is, and the interaction between the elderly and the environment, there is a change bi-directionally. Be it because of retirement, how the people hereafter see you, and how your children and the people treat you, and how much you look at it, and how much you are able to interact. Everything changes. And when it comes to illnesses per se, yes, of course, because of all this, elderly are at risk of painful conditions, arthritis, some chronic illness of your lungs and heart, breathing difficulties, then having developed a major heart disease, the heart attack, then had a major surgery, and you come back, you have to be on multiple medications. And as the risk of cancer increases, and diabetes and hypertension has become like an epidemic of illness, wherein most of them in our country after 40-50 have one of this, and has to take medications lifelong. And there is a risk of the difficulties with all this is, one is you have to take medicines regularly, you need to go keep checking your blood test, you have to have appointments with your doctor, and the kind of food you eat, you have to make major lifestyle changes in that. And also there's a risk of stroke that increases with the elderly. And the part of your body which is affected also will vary, which might make it very incapacitating for that person, that they become completely bedridden. So these are some of the examples of the physical illnesses that elderly are at risk of, and what are the difficulties they will be facing because of that. So when it comes to mental illness per se, uh, the two D's that is that increasing the risk of one another, and it's common in elderly, is depression and dementia. When I say that it increases the risk of one another, somebody who is having a recurrent depression is had even in adulthood and all that, has is at a higher risk of developing dementia when they age. And also a person who's suffering from dementia because of not being able to do their things on their own, that makes puts them at a risk of developing depression. So the two major D's of the elderly are this depression and dementia. So elderly at the same time, when it comes to mental illnesses, elderly also have the risk of developing new onset of severe mental disorders, be it psychosis or substance use disorders. I know you will have another session on what are the mental disorders as such, or the different names and how they manifest. So elderly are also at risk of developing these kind of symptoms first after the age of 60 or 65 also. And also there is other way around, wherein a person who's already mentally ill and having a disorder will age and will have worsening of that because of the age and other factors. So that's what is the other, or worsening of the pre-existing illnesses. So all this can be there in a elderly. um, so now that we have seen that elderly are in general at risk of developing severe distress because of the physical changes, the psychosocial changes that happen with them, and the difficulty in processing things psychologically. And there is also a risk of physical illnesses, arthritis, cancer, diabetes, all that, which will again increase their risk of developing some psychiatric illness. And there are people who already would have a psychiatric illness, who become elderly, and things can worsen at that phase of life. So overall, the this is I've explained all this for you to give an understanding of what are the risks, and why elderly develop, why we are focusing specifically on behavioral issues in elderly, because of all this risk that these kind of changes can happen in them. So now coming to elderly depression as such, why we are specifically dealing with depression in elderly is because it might not be the same way as a depression you see in a 20-year-old or a 30 or 45-year-old person. Wherein those person people might come to you telling that they are feeling low, they are feeling depressed, they don't feel like working anymore and all that. Whereas in elderly, many a times the for a person who's developing depression at age after 60, 65, or 70 be it, might not say that they are feeling sad, but that can be a more of sense of feeling empty rather than sadness. And it is not always that they're sad and worried and anxious about what is going to happen next. More of their expression of emotions can be more of, very irritable mood all the time. And the energy levels in depression is expected to be low, as you have already learned. But here they can be very agitated and restless all the time, pacing around. So it might be different from the generally the depression that you see, wherein a person is very low, dull, not interacting and quiet and not moving around and just sitting at one place. I mean, elderly, this can be different. um, so the speech and the interactions, everything can come down. And the thoughts, in depression, in other peer, in generally adult, we see there is excess ideas of, the guilt feelings, and feeling helpless, hopeless about the future, and feeling them to be worthless. Whereas in elderly, the thoughts can be more of, generally there, many of them will minimize the problem that they are experiencing, or deny that they are feeling sad or depressed anymore. Or there can be, thoughts of nihilism. That nihilism is something like, very negative view about the whole thing, that death is eventuality. They can start feeling like they are actually not alive anymore. There can be there to an extent that they will feel like, some part of their body is already dead, that things inside intestine inside them have already rotted, and they might feel as if they already don't exist. So these are some of the differences in the manifestations in depression in elderly, which might not be very straightforward, like other patients wherein, depression is seen. So there can be tragic incidents that are happening in life, or negative thoughts, or because of multiple reasons that you feel socially isolated, multiple physical issues, all that, and a reduction in your appetite. Generally only there is a change in your the food intake and the mobility, which might worsen when they become depressed. And with multiple medications, the risk for use of substance, everything increases, and all that can be seen in elderly with the depression. So, as I said, it can be associated with medical illnesses, psychosocial adversities that happen, and marked memory disturbances. Uh, and something that I have to keep in mind, that it can also happen in person who was so far a well-adjusted person with good resilience to handle stress earlier. So, somebody at age of 70 years, you we might, else if you know them personally, or if you look back at their life, you might generally feel that that person had seen a lot of adversities, and he was very strong, had very good problem solving skills, and they would have seen many stresses in life and would have handled it much better with good coping skills. But then as they become old, now they might not be able to do so, because of all the reasons that we have discussed earlier. Because of the gradual decline in their capacity and the skills to do it. So what I'm trying to say is, so the biological factors play a major role for a person when they develop depression when they are elderly. So recently only you would have had a class on, grief and death and dying. So each one, has a different way of coping with losses, and in elderly might be very different, because of the things like, they might lose their partner, who has been like, the wife or the husband, for with whom you have shared the majority part of your life. 45, 50 years you would have lived together, and one might have been dependent on each other. So all that is very different. To losing one of such a significant life partner can be a very huge stressful thing, or unexpectedly, suddenly, or because of chronic illness, your own children might die, or your close friends in the community will die. And especially if your partner had been sick and you have been the caregiver taking care of them so much, there can be sense of guilt that can happen after their death. Then suddenly feeling helpless anymore, especially, this known that elderly males tend to have difficulties in coping with grief when the wife dies, uh, because of multiple factors. Generally in our culture and all that, elderly male has difficulty staying alone to take care of the house, to take care of the day-to-day things and food and everything like that. They might be forced to go and now live with the children and all that. So they might start having sense of helplessness, then suddenly feeling lonely, that people around you are no more, and everything changes. And with age, there can be a kind of anger that can be there, or they can become very stubborn and rigid, and frequent memories of the past they might have shared so many things for so many years with their partner. So everything every day might remind them of something from their life, and all this will lead to depression and anxiety, and very difficulty to to cope up with this. So why I'm stressing on grief specifically in elderly is, as you might have understood, that grief and the manifestations are very different, but then it's very normal for each individual to undergo grief. But then in elderly, you should not just think that it is a normal grief, but you have to understand that they are at a higher risk of going into depression after losing somebody. So you cannot brush aside it as just normal grief reaction, but you have to be much careful, because of the elderly and the situations around it and how they cope up might be different. So it can be biological if the symptoms of reduced sleep, change in pattern, and marked loss of appetite and weight, and neglect in self-care happens, or if there is a excessive guilt that they were responsible for that person's death, or when this ideas of helplessness, worthlessness, and hopelessness creeps up, and when there is a very marked reduction in their interactions, and they become very withdrawn to self and sitting at the corner and not interacting at all, and the severe loss in their pleasure and usual pleasurable activities. All this are indications that the grief period, that during the grief, that it could be depression in elderly, and we need to be little sensitive about it and careful and pick it up earlier than in others. So now that we have understood about depression and grief, and how that can also increase the risk of depression, and how depression can be different in elderly when compared to the adult population. Now let's go into the other major disorder or that we have to deal with is dementia. So, as we were discussing earlier, with process of aging, some amount of memory loss is usual. So, which is generally when you see, as I told already, that there with the neuronal loss that happens every year, general memory loss is usually very gradual, and it is more for the short-term recent memory than the long-term memory. What I mean by the recent memory is about what are the new things that are happening today, and like what was told to that person in a particular less than 24 hours, and if they have to learn something new now, those are the memories that are usually affected, whereas their long term or their old memories kind of remain intact in a general process of aging. Um, so that's what a clue is, that a person might forget the name but never the face, or not the face generally when as they age. The every one of us will feel that we are having this memory problem. Everyone feel that we keep forgetting. So that's where this thing comes in. Like all of us might, because we are preoccupied with something else, or that while keeping the key somewhere, we might not register where we kept it, but when we are searching, we know that generally we keep at two or three places where we generally keep, and we are able to go search and find the key. Whereas in dementia, when it is actually a significant memory loss, it is generally said that it's not about where the key is kept, but then rather totally forgetting that the key itself existed. So totally forgetting about the key. So you kind of, I guess you are able to follow what I'm trying to say here, that all of us will have a memory problems, like losing the key isn't about totally forgetting the act of keeping the key somewhere. So you will go search for it, whereas for with dementia or significant memory loss, it is totally forgetting that that key exists and you are the person, you kept it somewhere. So to that extent of memory loss is when it becomes very significant. So with dementia, there's a marked change in your memory function, to name even the normal objects, to point out that they might recognize things on seeing it, but they might not be able to name it, be it the fan, light. So to even ask for water, or they want help to ask things to be taken and given to them, or even if they're searching for it, they might know what it they are searching for, but might not remember the name. Or there is a difference in the difficulty in the language functions also. The number of names that you remember, or all that comes down. And that can be behavioral and personality change, or that is associated with dementia. And difficulty in carrying out the routine activities, even that of self-care. And there is a gradual progressive worsening of every functioning part of your brain. So as we all know, memory functions is related to the hippocampus, but with dementia there is a loss in every part of your brain. So all the functions, day-to-day functions gets affected. So it is not merely the memory loss, but then difficulty in performing even the familiar tasks, problems with the abstract thinking, frequent memory loss that affects the day-to-day living, poor or decreased judgment, because of the frontal lobe also is affected, problems with language, forgetting the simple words, and all the disorientation with time and place, to to even realize whether it is day or afternoon or night, or which year, which month we are there living, and the place, to find ways within the home, from your own room to go to the bathroom, or to the kitchen, to the dining hall, navigating that place, directions, everything can be affected, and significant change in mood or behavior. So basically it is not just forgetting things. It is about every part of your brain is affected, that your ability and the skill to do those things also will reduce. So they might have difficulty even to wear their clothes. The action, your parietal lobe is involved in carrying out these activities of to wear your shirt and button it, or how to take bath, everything. So even when that is affected, there is difficulty in that, and especially the finer movements of buttoning, or eating without spilling, to correctly take the food and put it in your mouth and chew and eat. So every part, every action is affected as each part of your brain gets affected. So it is not just the memory of something, it is about every part of thinking, your language, your naming, your ability or the skill to do something, your problem solving, all this together. And general change in the personality and the mood happens as there are losses in the brain. And because of all that, it leads to difficulty in carrying out their day-to-day activities itself. And this, especially in the beginning stages, when they realize or have a understanding that there is memory loss that is happening, and that is causing them difficulty to with day-to-day activities, it leads to a lot of frustration and anger, especially if they keep forgetting things and they keep asking again and again the same thing, or not able to understand why they are not allowed to do certain things. That will lead to they feeling very restricted or dominated by other people, and that will lead to anger and other issues. So now that we have understood the dementia also has a lot of behavioral component to it, and how depression also can have, and there are other risk of other psychiatric illnesses also to happen. And with the change in transition in their role, and the psychosocial uh, changes that happen with them, so the behavioral manifestations can be many, 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 or the reasons for that can be anything. So the difficult behaviors generally that are reported are they're feeling always restlessness, feeling kind of agitated, sometimes that agitation, restlessness, and the distress leading them to become very aggressive, and the frequent change in their mood swings, and hallucinations and all that. You will be understanding more about it when you understand mental illnesses in the next session. So they are at risk of developing hallucinations, and the sleep disturbances, it can be very marked, wherein difficulty in falling asleep, as well as getting up much early in the morning, like 2 to 3 hours much before than their regular wake up time, or multiple times they might have to wake up for multiple reasons. One somebody with frequent urges to urinate have to get up multiple times, and go to the bathroom, and then after that they eventually lose sleep, and lack of sleep again will lead to frustration, mood swings, and being restless. And because of that, they can, there can be critical and demanding behavior, generally because of the psychosocial changes that happens and how they are adapting to it, or because of dementia, wherein they are not able to understand that there is a change in the environment and why people are restricting them. So all that can lead to critical and demanding behavior and confusion. As I said, they might not know, be able to remember the date time anymore, leading to a lot of confusion in recognizing people, understanding what is going on, what is the situation right now. Especially even in the pandemic time, you might have told your parents and elderly that to stay at home, not to go out, and all that. It depends on how they take it and how much they are able to understand. They might see other people going out and coming regularly, and why that particular person is not allowed outside, and so that all that leads to demanding behavior, and very rigid attitude and stubbornness comes in. And finally, in dementia, there can be wandering behavior. They can get lost, or not even recognize that this their own house or people around, and might go out at any time. And finally, when your judgment is also affected, can lead to certain socially inappropriate behavior. In dementia, they might not even know where the bathroom is, and go and mixture it, pass urine in the public, or something like that can also happen. uh, so these are some of the general overview of what are the behavioral issues that can happen in elderly. So not every time it is because of a major illness or dementia that elderly will have behavioral disturbance. It can be as simple as some chronic pain which is not responding adequately to medications, or a loose tooth, or generally now, after a loose tooth and dentures, they might have to wear new dentures, and that can be ill-fitting, that can be painful. That itself can be very frustrating and irritating for the person. And generally, because of reduction in their sensory system that we saw before, or uncomfortable environment in which they are living, lack of proper nutrition, and because of long-term medications and its side effects, and physical illness. And as I said, mental illness, be it depression, dementia, or other psychiatric illnesses. So it's not always that it is something major. It could be something very simple, that things are happening which might have been missed, or we generally tend to over see it, or kind of reject looking into these kind of smaller things that could be contributing to a significant behavioral change in elderly. So now that we have understood all that, so when a person with some behavioral disturbance and elderly, when they come to you, how our approach should be? So it is very important to to preserve their dignity when we are interviewing them. Generally, as a counselor, or a therapist, or a doctor, this age difference is apparent, and they are much more elder people, who might expect respect, and whatever is expected culturally, that dignity and how we treat them should be maintained, even if they are your clients. And just because they are elderly, who was brought by their children to you, doesn't mean that they are not capable of talking alone with you. Or sometimes children might think that he is already losing his memory, he won't remember things, so I will stay with him to talk to you. So but then try to give them some privacy and allow them, give them the space, and try to talk to them, and wherever possible kind of show affection and support whenever possible, and speak slowly and clearly and repeat if needed. So because of multiple reasons, sensory, as such, hearing capacity might be lesser. So it doesn't mean that they cannot hear you clear. Just because they didn't hear you first time doesn't mean that you should shout to them. Many a times it could be because difficulty in understanding the clearly, or to register it, it might take time and it might be slow. So you have to be with a soft voice to speak slowly and clearly and repeat it needed, and to be polite. You cannot, if you have to repeat it multiple times a particular question, you should not lose your temper, or you have to be very patient with them, understanding why there can be a difficulty. And of course, empathetic listening is something which is very, very important. And when you're talking to them, first, there can be multiple reasons wherein they can be confused and not actually understanding what is happening around them. So first, check whether they are able to comprehend things. So asking them simple things like, can you show me your right hand, can you just put your tongue out, all this will give you an understanding that okay, this person is able to listen and understand what we are asking and able to follow the command. So understanding their comprehension first is first step. If that itself is affected, there is no point in asking them repeatedly certain things, and expecting certain answers, which they might not have comprehended the question only with correct in the first place, and you just keep asking the same question, which might be very frustrating for them. So check whether they are able to identify people correctly, who has brought them and who you are to them and to whom they are talking to, just to prevent, when they are in a confused state, or not oriented to time, place, person, that might not be the correct time to interview them. And once you set all that, and then okay, now that they are in a clear state of mind and their consciousness is good, then you go on to talk to them, and assess for their social support, and ask their perception of the available support. Just because they are living with their children doesn't mean that there is adequate social support for them. So assess their perception of the available support, and identify if there is substance use is contributing to the current situation. And once you feel that grief is significant, or forgetting issue is not just the normal aging for age related forgetting, but it is much more, where every part of their living is affected, and you feel like it's a significant memory issue that needs evaluation, then refer to the doctor or the experts, right? So what are the things, smaller things that you can do with an elderly? So it's kind of help them maintain their independence and self-sufficiency in with whatever remaining skills that they have. Not everyone needs to be completely be dependent for everything. So try to look at what are the things that they can do on their own, and make them feel self-sufficient and skillful in doing that, and feel empowered that they're able to do those things. And the most commonest thing is just to listen to them as they grow, and as there is a change in the environment, and when they lose their friends or the social support and all that, they might not have people to just talk. Most of the elderly just want to share their experiences, their sense of achievement, what they have achieved in life, and the wisdom they have as they grow older. So they might want to just share those things with other people, so just listen to them. And one of the best things that you can do with them is narratives, reminiscing about their past, to just ask them, if you get to know about them, so just tell me more about when you were in a particular work time and this difficult situations, how did you handle it, and what were their achievements, and how hard they worked for it. And you can ask them about what were their difficulties while upbringing the children, and and interesting incidents from or interactions they had with their children, and you know, all those happy memories and all that things, and their sense of whatever they have achieved and the wisdom they have accumulated over time, listening to it, asking, being genuinely curious about it, and learning with an interest to learn from them, all that will definitely help them. And you know, as I told, as try to maintain an independence and also reinforce their sense of productivity and involvement. Many of them might feel that they are just a burden, especially if they are bedridden, and you know, they feel like they are just a burden to the family. There might be, you know, even if they are bedridden doesn't mean that everything is lost. There can be a person at home, elderly, whose advice and wisdom might be useful to the family at that time. The children might still come to them for their advice, and you know, to ask how things are done, especially these days. You know, even the smallest of things, like when you have to carry out certain rituals or you know, festivals, we might go, or when we are conducting a marriage and all that, to we might go back to the our elderly in the house and ask them how this particular ritual is being done, and what are the things that is required, how to go about it, and all that. So you know, to they can be of you have to identify those kind of things and reinforce them about how they are also involved in everything happening at their home currently, and that sense of productivity that has to be again reinstilled to them. And always ensure that you know, the family, community, and the health support are available, and they are not felt or left lonely and isolated. So these are some interventions that you can do with them. And when it comes to caregivers, especially in case of, you know, dementia is the most significant burden of taking care of elderlies when they are uh, suffering from dementia, and you know, they have to completely depend on the caregiver for everything, you know, from dressing to, you know, they might to go to the bathroom, and many times they lose the sense of, you know, the bladder is full and all that, that they might wet their clothes. So to again clean them up and everything, the caregiver has to do it. The caregiver generally, you know, could be their own children, but in India there's a unique position, and a lot of studies has also shown us that the daughter-in-law in the family is the person who is taking care of a very elderly, uh, her own father-in-law who is suffering from dementia. So for the caregiver, there are a lot of aspects which can be uncomfortable, you know, to take care of them, to clean them up after, you know, every time they wet or soil their clothes, and to feed them every time and help them to go have bath and everything. It is very, very distressing for them. And despite all that, that person, the elderly who is suffering from dementia, might not even recognize who you are or misidentify you, and might show anger and might not understand what is happening and have a lot of behavioral issues that goes on. So this becomes very, very burdenful for the caregiver. Therefore, spending time with the caregiver and listening to them empathetically, and you know, giving reinforcing again, and appreciating them for all the efforts and they are taking to take care of that particular person, and identifying them what are the very distressing behaviors, and you know, giving them some smallest tips, and referring them to support groups wherein they can share tips about handling elderly. And many times they might not even gone to the doctor yet. For a person elderly at home is not sleeping in the night and is always very angry, and this thing could be because of dementia or depression and all that, and suggesting them to go to the doctor, and you know, starting medications can help a lot of behavioral issues. And identifying the realistic support available and help available in community, and giving them those details, giving them the details of resources of help available. We'll also share some of the links with you about what are the things that can be shared with the caregivers. And general tips overall that can be given to caregivers is, while handling elderly who's dependent on them, to whenever doing simple things like dressing and bathing, it might become very mechanical for the person who's giving the care. So they might forget to ensure the privacy of it while doing it. So those are some things that has to be reminded to them, and that will help the elderly also. And to establish a daily routine for that person, and ensuring the safety, like a chair to sit while bathing, a mat to prevent a slip, and in the support rod, ramp, etc. Use of identification bracelet and necklace that can be given to the elderly, especially when they are suffering from dementia, where there's a risk of wandering and getting lost. And ensuring that doors are locked in the night so that they don't suddenly wake up and wander off somewhere. And if they have to dress them regularly and nurse them regularly, using clothes that can be easily removed. And if they have to wake up multiple times in the night to go to the bathroom, or they keep soiling the bed, then suggesting adult diapers, then limiting the water intake in evening and night, and to ensure hygiene and use of bedpan wherever needed, and all the measures to prevent fall, slip while getting up from bed. These all might look trivial, but these are certain things that might have been overlooked, and this might have led to multiple falls multiple times, or frequently falling ill because of lack of hygiene, or all those things might have been overseen or forced. So these are small things that has to be seen, given attention and seen, and check whether these are the things that has been done. And try and identify the triggers for the anger and try to avoid it. There are certain things that they might not like, and if you repeatedly insist them on doing it, they might get angry. And identify the activities that will suit them, example music, or evening taking them for a walk, on all those things. And avoid confrontation and argument with that with the person, and spend time with them with simple tasks. Just sitting with them with the old photo albums and recollecting them together, or if they like painting and drawing, something very simple that both of them can sit and do together. Not complex activities where again their mind has to be put into, but some very simple things. And while dealing with dementia, use of memory aids and cues at home for them to remember things, and to make it easy for them for having their routine. What is generally said is that elderly person has to be in a particular room where they get used to, where the bed is, visibly put their clothes, and then put the cues and labels for this is the new cloth that is there, and next direction to the bathroom, so that they can go. And it is all about retraining them in daily in this activity, just like how you train your kids when they are 1 year and 2 years old. The same thing you might have to repeat multiple times for the elderly, so that a lot of frustration comes only when there is a change in the routine and something new has come up that they have to navigate, like frequently shifting rooms or houses. That can be difficult for them, whereas getting used to one thing repeatedly will help them to just carry that out without difficulty. And if there is a loss, difficulty in remembering date, diet, and time, making ensuring that having a daily sheet calendar visible. um, so that and making them to to daily change the calendar sheet, and asking encourage after some time you can put a whiteboard in another room, and while having simple task with them, you can ask them to write the day, date, year every day, so that they are kind of learn that and get reoriented to what is the uh, time in which they are living now. And as I told you, spending time looking at photo albums and encouraging them to speak about their memories are some tasks that can be done with them together. So having said all that, elderly are also at risk of abuse. So suspect elderly abuse if there is unexplained injuries or frequent injuries, or marked distress by the person when caregiver is around, that they don't want to be with that particular person and they're very much distressed about it, and or they are kind of guarded and not wanting to speak about it, or caregiver is very impatient with the person and they themselves have behavioral issues and substance use, then the way they are handling the elderly might be like mishandling them and beating them up, or all that can happen. So elderly abuse in a family context can be physical or psychological abuse, or emotional, financial, or sexual in nature. How physically mishandling them, beating them, and psychologically making them feel like, by repeated critical comments, that they are not able to, like when they repeatedly soil their clothes, being very giving them rude comments about it, and showing your frustration about taking care of them, or financially also abusing them, you're like kind of cheating and taking money from them. All that can also happen in a family context. And elderly, especially if there is a memory issues and vision and sensory problem, when they go out alone and all that, like, elderly abuse of unknown by unknown person, sexual in nature, is also possible, and they might not be able to come and talk about it. So whenever you suspect or identify any of it, kindly report to authorities. And so this is one of the elderly helpline that is available. If you see or know a person who's being abused and is suffering, you can always at least try to get some help for them. So yeah, that is the end of the presentation. And please do type in your comments or queries in the comment section, and we'll have a discussion on the same in the subsequent class on Saturdays. Thank you.